Hello, everyone. I'm Sherry with the CGH Health Foundation, and welcome to our Growing Healthier program for February. This educational series is sponsored by the CGH Health Foundation. In our Growing Healthier programs, we try to educate you about important health topics, and it gives us a chance to introduce some of our providers. And our programs are hosted by Dr. Bill Bird, our Chief Medical Officer. So this month, we are going to be talking about our cardiology services, and we're really excited that we've been able to expand our cardiology services to our Morrison clinic. And Dr. Bird is going to be introducing Dr. Rashid and nurse practitioner Mary Madison. And we'll get to that talk in just a moment. The CGH Health Foundation has added a new service for our patients with dementia and their caregivers. Our adult respite care program is now available so that caregivers can drop off their loved one and have them spend time with our qualified staff while they go and take care of any personal business that they need or just to get a little break from that caregiving. There are limited spots available and a pre-screening is required. And so in order to learn more about that and to enroll in the program, you can call Beth Sturck, our dementia navigator. Her phone number is 815-625-4790. Her extension is 3977. The other thing we have coming up on Monday is a yoga workshop. So if you have been thinking of trying yoga or you just want to get some more information, we'll be doing that yoga workshop at our CGH Health Foundation offices, the community room at 2600 North Locust in Sterling. Our presenter is Brandon Lumsey, and Brandon teaches our CGH yoga class. It's every Monday night at 5:15. And the workshop's going to be presented at 4:00 in the afternoon. And Brandon's going to talk about the history of yoga, the health benefits. He is going to go through some poses that you might typically see in a yoga class, and you'll have the opportunity to ask questions. And then if you would like to, you can stay and stick around for our yoga class at 5:15. We want to thank everybody in our community for their support of the CGH Health Foundation. Our campaign is wrapping up in a couple of months, and you still have time to make a donation if you would like to help out our cause. Your donations all stay local, and they help to fund programs that support the health of our community members. So please call Amanda at the Health Foundation or Sierra if you would like to consider making a donation for us. Make sure you put next month's Growing Healthier program on your calendar for March 20th at noon here on Facebook. You probably know that we've been doing some extensive remodeling to our lobby and admitting area at CGH. And it is very pretty, but there are also some very good benefits to that for our patients. And so Cindy Zander, our Vice President for Operations, is going to be touring the new lobby area and pointing out some of those features. So again, that will be broadcast here on Facebook Live at noon on March 20th. And I know Dr. Bird is out there ready and waiting to talk to Dr. Rashid and Mary, so I will go ahead and turn it over to him. Are you ready, Dr. Bird?
Hey, thanks, Sherry. Appreciate it. Hi, this is Bill Bird, CMO here at CGH Medical Center. This is my first time. I'm usually doing it I always doing it in my office. So I'm doing this remotely today. So thankfully for technology, I think it's going to work just fine. And yeah, since this is Heart Month, we thought it would be very helpful to have one of our new cardiologists, Dr. Rashid, and his nurse practitioner, Mary Madison, with us to talk about all things heart. Oh, and here's our CGH team. So you see Dr. Rashid there in the back right, and then let's go clockwise. Let's go clockwise from him. Dr. Kiso's bottom right, Dr. Singh is bottom left, and Dr. Sherris is back left. Really good. Very thankful for our cardiology team. And then also those are all of our nurse practitioners. Mary is 1, 2, 3 from the left. And then we have, if I'm just going to rattle them off, right to left, I think I see Jill Bell and Tracy and Teresa, and then Mary again, and Polly and Danelle. So that's our cardiology physicians and APP team. But I'm going to be talking to just two of our cardiology team, Dr. Rashid and Mary. So let's get them on the line here. Hi, Dr. Rashid.
Hi there. Good afternoon.
Hi, Mary. Can you hear me, Mary? Mary's.
Hi, can you hear me at all? Because I can't hear you guys.
Yeah, we can hear you, Mary.
No.
Yeah.
We can hear you.
Yeah, we can hear you.
Well,
you
we'll
can?
see what we could do in terms of when we ask a question for Mary. We'll see if we can get that figured out. I'm going to start with a question to Dr. Rashid. Dr. Rashid, can you tell us a little bit about yourself and why you decided to pursue a career in cardiology?
Well, my life started in India. That's where I was born, and my childhood in India. And when I was on my way to medical school, my dad and mom, my family decided to move to the United States. So I went back to medical school there, finished that up, and then I came and joined them in the United States. And subsequently, I had my training, family practice, and internal medicine in New York, the State University of New York. Then I went to Cleveland, Case Western University, Case Western Reserve University, University Hospital. I did 2 years of clinical cardiology training and then interventional cardiology training for another couple of years. And I was there part-time faculty. And then I had a friend over here in Midwest in Clinton, Iowa.
Mm.
He was an oncologist here with Medical Associates. And he convinced me to come over here. And I have young children, and I wasn't very excited raising them in big cities. So I said, let us give it a try over here in a smaller town. And I wasn't very optimistic that we would last here very long. But lo and behold, after I came here, I really loved it. A smaller town, lots of personal touch everywhere, and then healthy for the children. So they all went to Clinton High, my children. They did very well. 2 of them are physicians, one oncologist, the other family practice hospitalist. Third one is an attorney. The fourth one is doing her master's. So I liked here. I stayed around here. How did I get interested in cardiology? I was fascinated when I was in medical school that heart disease is the leading cause of morbidity and mortality, leading cause of the death, especially the ischemic heart disease. And I was fascinated about it. And then when I was doing my internship, and I had a cardiology attending, Dr. Larry Elschuld, that was in New York, and he kind of sparked that interest even more. So I decided to go into cardiology, and I haven't looked back. I really, really enjoy it. I can't imagine myself doing anything else, even though for a while lifestyle stinks, but I just love it.
Good. I'm glad to hear that. So we're still working on Mary, but I'm going to keep going and asking Dr. Rashid questions. So Dr. Rashid, in your career, can you talk about how cardiology has changed during that period of time from when you started to now?
Oh my God, I have seen quite a bit. You're talking about spanning 50 years when I got into medical school. And so much has changed. It probably will require a whole session just to talk about all the developments that we have seen over the last 50 years. Just to give you some idea, and then I will try to get an overview. Just take the management of the heart attack and how it has changed over the years and what impact it has made. Like we are talking about 60s when I was young child in the school. If somebody had a heart attack, out of 100 people, 35 to 40% won't even survive for 30 days after that. There's hardly anything available. Then at that time, the researchers realized that the most of the people, when they have a heart attack, and the reason that they die is because their heart goes into a bad rhythm that leads to the cardiac arrest. And if you shock them, that brings them right back. And the majority of the deaths within the first 24 hours or within few hours is because of the bad rhythm. Ventricular tachycardia, ventricular fibrillation typically. So that was developed initially. Anybody who is suspicious of having a heart attack was put in the intensive care unit. And if they went into bad rhythm, they zap them out. And that just brought down the mortality, initial mortality right to like 20-25%. So that was a major, and that was in 60s, a major development. And after that, the management of heart attack, there was some medicine developed, aspirin and beta blocker. Still mortality was fairly high, 30-day mortality, we are talking 20-25%. Then the next breakthrough came like in late 70s, early 80s. That was the thrombolytic treatment. Early 80s. That was a huge change, clot buster medicine. And what the researcher found that, the plaque builds up inside the artery that supplies to the heart, and then there is crack, and on top of that, a clot builds up. And it's a little tiny clot, but enough to cut off the blood supply to the heart muscle. And if you can get rid of that somehow, at least for that moment, you can reverse the heart attack. So the clot dissolving medicine got developed, and it was very exciting. It really, second rather big breakthrough for the treatment of the acute heart attack. And that brought down the mortality to about 30-day mortality to about 10-15%. And then there was further development. Researchers thought that why not just go mechanically and try to get rid of that clot when the people are having a heart attack. The cath lab has already developed at that time, and lots of people who had a heart attack or clot buster medicine ended up going to the cath lab anyway. So let's try to bring them in to the cath lab while they are doing the heart attack. And if you do it fast enough, you can salvage lots of heart muscle, because with clot buster medicine, still about 30% won't dissolve the clot. And I was fortunate enough to part of some of the trials, actually. I was at Case Western University, and we were comparing that if you bring the patient comes with a heart attack and take them right away to the cath lab and do the angioplasty, or give them the clot buster medicine and see if we can make any improvement. And at that time, the concept was, oh my God, people are having heart attack. They can't go to the cath lab.
Right.
They are too sick to go to the cath lab. And later on, we found out the sicker, the better. The more sick they are, the quicker you bring them to the cath lab, because that's their best chance. And that brought down the mortality to 30-day mortality to 5-10%. So right now, with all the sophisticated balloon and stent, it's about 5-7%. So we are talking about from 35 to 40% to 6-7% mortality. And that is a major advance. In terms of medicine, like I can give you some examples. There are some of the powerful medicine, especially the statins, that actually change the way we manage the coronary artery disease, especially the chronic ischemic heart disease. The statins, the ACE inhibitor, those were major, and the beta blockers, and of course aspirin, they were there for a while. The recent trials are showing that the modern powerful medicines, they are competing with angioplasty and stenting for the chronic ischemic heart disease. There has been actually 2 major trials. One came out 2-3 years back, ischemia trial, that shows that with aggressive medical treatment, there's no difference whether they go to angioplasty or bypass surgery. But this, we are talking about the stable patient. If it's unstable, like if they're having a heart attack or if they're unstable angina, then you have to go to the cath lab and get the angioplasty and stenting.
Yeah. You were talking about statins and also ACE inhibitors, which made me think about like what are, like nowadays, your goals when you're treating a patient who has known heart disease in terms of what cholesterol levels you're looking for and what kind of blood pressure numbers you're looking for as well?
Yeah, so once somebody gets a blocked artery or they had a stent or a bypass surgery, we know they already have the blockage. And as we stand right now, there is no cure for it, but you can manage it. You can keep it under the tab, and that's called secondary prevention. So the cholesterol, you really have to get aggressive with that. And the bad cholesterol, what we call the LDL, you should bring it down below 70. And even if you get it even lower than that, that really helps, in the progression of the disease. Sometimes you can, or a good blood pressure, same thing as blood pressure. The cutoff is 130 over 80. If you can bring it 120 over 80, that's the American College of Cardiology recommendation. That's awesome. However, when there are like elderly, who are 70, 80-year-old,
Yeah.
and so you can be a little more lenient with them because they get hypotensive, they fall, and hypotensive, low blood pressure can do more harm than good. So in those cases, 140 or even in 140s is acceptable.
Okay.
But yeah, rest of the others, 130 over 80 or better.
Yeah. You said the word secondary prevention, which is for folks who already have known heart disease. And I want another piece of secondary prevention that from what I've been hearing has changed in the last few years is also like the recommendations for what kind of anticoagulation do you recommend for folks who have had stents placed these days? So can you talk a little bit about what the latest is on that?
Yeah. So just give you some idea, the stent, when we put that stent inside the artery, it's like a chicken wire that prop keeps it open. And so that's a metal, that's a foreign body. And that metal is sitting right inside the artery. So that can clot. The body, the red cells, the platelet can stick to it and clot it and cut off the blood supply. So to overcome that, we put people on 2 antiplatelet agents. And what antiplatelet agents do, they make the blood inlet turn slippery. So they don't stick to the metal, that well. And depending upon different population, it takes about 6 months to a year that metal, that chicken wire that's sitting inside the coronary artery get lined by own tissue, the natural tissue, and then the blood doesn't stick to it. So for if somebody got a stent when they were having a heart attack, in that case they have to be on 2 antiplatelet, aspirin, Plavix, or Brilinta for 1 year. But if they are a stable coronary artery disease, then it's 6 months. And after that, they just are on aspirin for life, for long term.
Okay. Good. There's Mary. Hi, Mary. Can you hear us now?
I think I'm good now. Yeah, I can hear you.
Okay. Hey, I'm gonna while I have you, while you can hear us and we can hear you,
Okay.
I'm gonna give you a question here, Mary. Okay.
Yep.
I want to talk about, Dr. Rashid has been talking about some secondary prevention measures for heart disease and what to do for those things. But I wanted to talk primary prevention, and in particular, it's been out for quite a while now, but this heart check, the CT heart check where you can do calcium scoring.
Mm-hmm.
When do you recommend for the patients that you guys are seeing that they go about having that test done?
Well, the American College of Cardiology has a risk calculator that primary care providers can use to kind of risk stratify the patient. So it kind of goes off of patient's age, their sex, their weight, whether they do smoke or they don't, if they have high blood pressure or they don't, diabetes or not. And if your risk score is under like 7.5, then usually they're at low risk. But if a patient's risk score is between 7.5 and 20, which is more in the moderate range, then those are the patients that would benefit from that screening. Now, if a patient has symptoms such as anginal symptoms, chest heaviness, tightness, worsening shortness of breath, then normally we just do the stress test because that's more accurate. I mean, the calcium score will give you an
That's
idea, do they
amazing.
have calcium in the vessels? And then sometimes people need further, looking into it depending on the score.
Okay. So I'm hearing it's kind of the people that are in that middle layer
Right, right.
that would benefit. If you really don't have, if your cholesterol's perfect, your blood pressure's perfect, you don't have a family history, you don't smoke, you exercise all the time, probably not going to be a great fit. But if you're somewhere, then that, oh, here we go. How about that?
There it
Speaking of
is.
heart check, we have it over at the hospital, and I don't have my readers on, but I think it's like pretty cheap to get it done too.
It's
So
$60 now, they said. I think they've lowered it. It used to be like 99 or 100, so it's come down quite a bit.
yeah. So
Mhm.
anyhow, for people that are interested, that's an option for them over at the hospital too. So, well, thanks, Mary. Appreciate that.
Sure.
I had another question for Dr. Rashid, and that is just kind of like, I'm over the years with the techniques with coronary interventions. My experience with patients is fewer and fewer of them seem like they're having open heart surgery. But there are still some patients that need open heart surgery, and I'm just curious, like, who are the folks that benefit from having the open heart surgery versus these interventions that can be done without opening up someone's chest?
Yeah, you are right. The minimally invasive or the catheter-based techniques has pushed the surgery out of way in lots of patients. And we are tackling some of those blockages that only surgery could do that. But nevertheless, there are patients who have like extensive clogged arteries. There are three major arteries that supplies to the heart. And if you have three vessel disease, or if the blockage is very upstream, that covers a very big area, the very big area of heart muscle is in jeopardy. So the trials are showing that if the patient can undergo surgery, they are better off going for bypass surgery because that's more durable. But if the patient is not, healthy enough to go for surgery or high risk for surgery, even those blockages can be tackled by doing a balloon angioplasty and a stenting. So the extensive disease is one area where surgery still looks better. Yeah.
Good. I want to kind of shift gears just a little bit and just talk about, like, because you two have worked together for a while now. Tell me, talk to me about how you work together to take care of patients, because you're in the same clinic together. So can you, the two of you, kind of talk about that for me?
Yeah, I tell you, the CGH has put together an excellent team here in Morrison, and two of us are there, but we are backed up by three excellent cardiology nursing staff. And we have a very experienced sonographer here too. So this team, and one thing I always point out to lots of people who don't realize that there is so much work goes in the background before the provider, the nurse practitioner, or the doctor comes and sees you and spends a few minutes with you. So as soon as you make an appointment, we start searching all your record. We request your primary care provider, we request the other consults that you have seen, if you had anything done before that, any cardiac workup or other relevant test. We gather all those informations, and you haven't been here yet. And we put those information in our database.
Good.
And then you haven't even left your home yet on the day of your visit. And our staff is busy pulling up all the information, putting it together. And the doctor reviews them, or the nurse practitioner, the provider reviews them. And sometimes actually we pull up your images and refresh it and look at it. So there's lots of background on that. We got an excellent team here that we take care of that. So in last 6 months, we got lots of, we don't even have the 6 months yet. How much? 4 or 5 months, 4 months. We are busy, and our team has been extremely busy trying to gather all the information from everywhere. So that's very intensive. We are here, two providers. Mary and I, and one of us are always try to be available here. If somebody takes off or something, we try to, you know,
For each other.
not try not to overlap it. So
Mary, anything else that you would add to that question?
Well, and it's just so nice to have this team that I have resources with when you're a nurse practitioner. Obviously, we need the highly educated cardiologist to help us. And I know 100% of the time, if I have a question, Dr. Rashid's available. Even the cardiologists in Sterling have been awesome. I can call any one of them, and they are so helpful in taking care of the patient. And they really care about what's happening with the patient, which is awesome to see because you don't get that collaboration everywhere. So I feel like as a nurse practitioner, we rely on those for the tough cases that we have questions we maybe can't answer.
Sure.
So it's great to have them.
Yeah.
yeah, let me tell you one thing, that we have been in practice for almost 30 years, 28 years. And the people who I picked up when they were 50 and 60-year-old, now they are 75 and 80-year-old, So lots of elderly population. And over the years, they collected lots of diseases with them too. So, yeah.
Sure. Yeah. Yeah.
And I really have to compliment the IT department here at CGH. They are excellent. They're excellent. Can't compliment them anymore. Yeah.
Yep. They do a great job. So speaking of CGH, I mean, you're relatively new to our organization. Can the two of you kind of talk about, as you've kind of sent patients to CGH, I know you do a lot of as much as you can there in the office. You have an echocardiogram and those kind of things that you can do for patients there in the office. But for patients who have been sent over to CGH for whatever kind of work that needs to be done, what's your experience been and what's the feedback you've received from those patients?
Well, I can say from my standpoint that the patients are extremely happy with the care they've gotten. In fact, they come back here from being at CGH and they're like, everybody is so kind and so helpful. And it's funny because they always talk about your stress lab, and they said, they even feed you. They give you a coupon to go to the cafeteria. You wouldn't believe it, but that coupon means a lot to a lot of people. And they get to go down and eat before they come back for their pictures. And when they've gone for angiogram and they've come back to see us post, they're like, the doctors were so professional and so kind, and the place was so nice. The nursing, like they talk about everybody's so nice. So it really makes you feel good that you're part of that institution.
Anything you would add to that, Dr. Rashid, particularly in
Yeah,
terms of,
I
in
found
terms of the interventional
excellent
care and stuff?
Yeah, very top notch. As Mary said, the patients has been very happy, and I can tell you the quality of images and the way they do the stress test and nuclear imaging and echo imaging, it's top notch. So I really compliment. It looks like they work hard on it. Echocardiogram is very tech dependent technology, but it looks like they spend their time, they take their time to get the excellent images, because if you get us good images, we can get a lot more information from
That helps a lot, doesn't it?
Absolutely, absolutely.
Yeah.
We used to say garbage in, garbage out. If you put garbage, that's not going to get out. If you can put excellent stuff, you're going to get excellent stuff out. And nuclear imaging, the same thing. So my compliment to these people. So yeah.
Well, I've heard really good things about the two of you, and I'm for folks who are listening to this conversation and are like, I probably need to get something checked out, or I have a family member I'd like to have their heart condition checked out by Dr. Rashid or Mary. How do they go about getting set up to see one of you?
Well, basically, they can just call the main Morrison number to get set up. I'm not.
There you go. You got that number there.
They have the number at the bottom. Yes.
Yeah.
And basically, a lot of people are referred from their primary care, but we've had patients that have come that have not been referred, that just wanted to get something checked out, that have come. We don't turn people away. Our schedules are open. We try to accommodate as best we can. I know many times patients have to work during the day and they don't get off till later. I've said 100 times, if somebody's requesting a late appointment because they have to work, let me know. We'll work something out so we can get them seen, because we want people to get their cardiac care, because I feel like a lot of people kind of poo-poo some of their symptoms, and they really sometimes do need to get it in checked out before something happens,
Yep. Any other final, we're kind of pushing up on time, but any other final comments either one of you wanted to let the folks who are watching know about?
Well, let me tell you, everyone, that we got an excellent cardiac team here for outpatient cardiology care in Morrison. And rest assured, and we are backed up by excellent team at CGH Medical Center. The interventional team is excellent there. And so rest assured, we are here to take care. And if you have any further questions, you can always direct to us.
Anything from your standpoint, Mary?
Well, I could just say that we just want everybody to have an awesome health outcome, and we hope that, when you come see us, you're happy with your care. And if there's anything we can do to be better, we'd like to hear that from people. If there's something we can improve on, by all means, we're here for them. So
Great.
Yeah.
Well, Dr. Rashid and Mary, thank you for taking the time to do this interview. And it's great to have you there in Morrison, and you and your team are doing really good work. So we're so glad to have both of you. And I'll let you go and go about your days, because I'm sure you have plenty of things to do besides talking with me. But
Some
thanks
vacation if
for
you want.
taking the time.
All right. Thank you very much. Our pleasure.
So,
All right, take care.
thank
Talk
you.
to you later. Bye.
Okay, great. I have a few other items I wanted to show. Nicole Jones, it was our February Employee of the Month, so congratulations to Nicole. And Crystal, I'm going to butcher Crystal's last name, so I'm not even going to go there. But Crystal works up in our ICU, and she was a Nurse Daisy Award winner recently. And Ashley recently won our Sunshine Award. She works on our third floor, I believe. Yes, third floor. And we talked to Dr. Jones and Dr. Tran last month, if you remember our menopause conversation. Well, they want to talk with you some more, because they're going to have a ladies' night April 10th at the Mercantile. So put that on your calendars and show up and get a chance to have a little something to eat and meet and greet with Dr. Tran and Dr. Jones. And then next month, as Sherry alluded to, we're going to do a tour of our new CGH lobby and admitting area. It's coming together very nicely in terms of that project. So I'm looking forward to having a chance to show that to you. Okay, I think that'll wrap it up. Thank you so much for taking the time to watch this. And as always, if you enjoyed this, please feel free to share this with others so they get a chance to watch this as well. Thanks again to Dr. Rashid and Mary for taking the time to talk with me. Until next time, have a good month, and we'll see you soon.